Ladies and gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Salai, physician, entrepreneur, and venture architect. I'm really honored on behalf of the entire Afroturk TV group, as Afroturk TV, as well as Afroturk Agro TV, and now soon starting a new channel, Afroturk Health TV. We are hosting the director of the Mogadishu, Somalia, Türkiye Recep Tayyip Erdoğan Hospital. He served there. Professor Dr. Mevlüt Karataş has done tremendous job, mashallah. We are so proud for his work. And actually, when Recep Tayyip Erdoğan came there back in 2013, a hospital has opened there. And this hospital, 10 years later, hosted a very important director, Professor Dr. Mevlüt Karataş. And he has actually done amazing work, opened new facilities, the first open heart surgery facility there, opened a very important clinic, also took care of the orphans and the children which went through big trauma. And both psychologically and physically abused children have been taken care of thanks to Professor Dr. Mevlüt Karataş. And today, I invited him again the third time because he has done such a good job. And with all the messages you have sent, all the messages came all the way from Somalia, from Mogadishu. Thank you very much for your warm messages. We love you, we respect you. As your Turkish brothers and sisters, Turkey is always with Somalia. Forever, inshallah. And with that, moving to my dear brother, Professor Dr. Mevlüt Karataş. Welcome to Afroturk TV.
Thank you very much. Thank you for your good invitation.
Thank you.
Third time.
How are you today?
Fine, Alhamdulillah. How are you?
Very good. There is a big interest, especially what you have done in the hospital, all the work with your team, and your thank you messages.
Yes.
To the president of Somalia, to the health minister of Somalia, to the Turkish minister of health, previous one, as well as Recep Tayyip Erdoğan, has received big announcements. And that's why they said, you need to bring Professor Mevlüt again to the studio. Thank you very much for joining today.
For your invitation.
In this episode, I will talk more about the chronic health problems in Somalia and Turkey, what you have done in your training in Turkey, and then the healthcare reforms in Turkey, and then what healthcare reforms needs to be done in Somalia. And then we will talk about the public health recommendations you have, as well as, the chronic health problems that are now facing, and also finally, your recommendations for your messages for all of our brothers in Africa. So what the Somalian experience should teach the rest of the Africa, whether it's Nigeria, Ghana, Senegal, South Africa, Tanzania, Kenya, doesn't matter. What are the teachings from there to here? But starting with the chronic health problems. When you came to Somalia and you set up the hospital, you opened open heart surgery clinic, which was not easy. But you did 8 different surgeries from age 8 months to 80 years old, mashallah. Have you seen chronic health problem issues in Somalia?
Yes.
And what were the chronic health problems and how did you tackle them?
Yes. Thank you very much for your good invitation. As you know, the chronic health problems is the problems of the Turkey, yes, and the problems all over the world, also the problems of Somalia. My first observation is the diabetes. I examined many diabetic patients from child to the elderly age.
I see.
Yes.
So diabetes is a problem in Somalia.
I asked the Somalian doctors, what is the reason of this diabetes? Because diabetes rates very high. They said to me that the Somalian people have a habit, sugar consumption habit. Yes,
very high.
They are the sugar consumption very high in Somalia. So at the end of the day, diabetes mellitus is the developing and one of the biggest chronic health problems in Somalia. And we observed the bad diabetic lung. Diabetic
neuropathy, diabetic
food, diabetic food, and the infections on the foods and the amputations. Amputation rate is very high. And Turkish doctors because we had meetings with doctors. What is going on about this diabetic foot? The Turkish orthopedic doctor said that in Turkey, the patients they don't want to cut their leg.
I see.
But in Mogadishu, in Somali, the patients coming us and they say that please cut my leg, because the treatment of this such kind of
Very
wound is very difficult.
Ladies and gentlemen, as I mentioned, Professor Dr. Mevlüt Karataş has mentioned some chronic health problems, especially diabetes and diabetic foot ulcers. And in Turkey, unfortunately, people are asking to be restored or do some drainage or wound debridement. But in Mogadishu, unfortunately, because life is ongoing, they are asking the doctors to cut their leg, right? Is that correct?
Yes.
This is a huge problem.
This is a huge problem in Turkey. The Turkish people, Turkish patient with the diabetic foot, they don't want to cut their leg. But in Mogadishu, the people want to cut their leg because the very bad wound, leg wound, and they have to work in your life and they have to get money, and they say please cut my leg. I think this is the first
Problem.
the problem, and this is the differences between Turkey and the Mogadishu, like a health problem.
So,
And
as a chronic problem, diabetes is an issue.
yes,
What is the second issue you see?
I think the second issue, the malnutrition. As you know, there was a malnutrition in Somali recent 10 years, and the food is very limited in some region of some poor region, some villages.
So, agricultural reform needs to be done as well.
agriculture.
Diversity of different types of crops needs to come, right?
Yes. Agriculture is very important now. The Somali government is working on the agriculture
Yes.
reform, and especially babies needs the vitamins and then the other foods, and the breastfeeding is important.
So, training and education is important as well.
Small aged mothers.
I see.
There are many mothers. They married in the low age, 16, 17 years. They have many babies, and I think it's very difficult to feed all the babies. And the third health problem, I think, the tuberculosis.
Tuberculosis has become a
Yes, this is a pulmonary infection, especially pulmonary infection. And the tuberculosis infection is seen all over the Africa. We fight with the tuberculosis in Turkey for 70 years, and the tuberculosis rate is decreased in Turkey.
I see.
But when we look at the Africa region, the tuberculosis rate is going up because it takes long treatment period, 6 months. 6 months. You have to monitor all these patients. You have to give the right medication and
isolate as well, right?
Because isolate, you need the isolate rooms, and you have to diagnose with the modern medical equipment and devices. So the tuberculosis, I think the main one of the main public health problem of the Somalia.
Also, trauma, like because of wars and other things, do you see like post-traumatic stress disorder?
Yes.
Or other problems happening as well?
Mental health. You say the people is living another different and a difficult journey. There is a terrorism and then the war, and as you know, the mental health is very important for normal the post-traumatic depressions.
Yes.
Is very high in this country. And when we examine the health system, we examine the first step, healthcare, and the second and the third step, healthcare. In our medical school period, That is, we learned that the first step, prevention of disease is very important
It's the
step.
key. Yes.
If we prevent diseases at the beginning of the, we can treat the people, and we need low money.
Absolutely.
Yes. In Somali, Health Minister Ali Haji Adan is working hard man, I think.
Greetings to Minister Ali Haji Adan. Thank you for your hard work.
I gave the advices, the Ali Haji Adan, because I observed the Turkey, and I was worked as a director in Turkey. I gave some advice about the public health, and they are working hard. And in the Somali, I had a meeting with HIV meeting. It is also very high rate in this population, HIV. I think it is related with the prevention and the diagnosis techniques. If you put second or third level hospital, you can easily diagnose the HIV,
And treat it.
malaria, tuberculosis, and you can treat it. But if you don't have any system,
And it's spreading.
yes, you cannot treat and you cannot diagnose such as diseases. This is very important. And in Mogadishu hospital, in Recep Tayyip Erdoğan hospital, we have a unit. It's called the orthes prothes unit. When the patient
Leg amputation
lost
happens.
leg, we can create a prothese
Very
for his leg, and this is the only center,
Wow.
only center in Mogadishu, in Somali. These three or these four public health problem is very, very important.
So these strike you when you went there. I'm curious, these chronic health problems. What are your recommendations based on these problems? I know the minister is working on it, and you also established a training program. I mean, you are supporting. You train more than 200 resident physicians,
Yes.
all the doctors or managers. What is your recommendation? What should be the next step for them to not just improve the health of Mogadishu, but entire Somalia, and also take that learning to the rest of Africa, inshallah?
Yes. The first step, I think, education. If the Somali authorities educate their doctors, nurse, all health staffs, they can fight with this such as problems.
So increase the number of healthcare and also increase the quality. Right?
Yes,
The people.
this is the
Yeah.
first step, and this is I think the governmental strategy. If the governments, the Somali and the other African countries is the brother countries of Turkey, we can share our experiences with minister level or the university level.
Yes.
The universities can do good connections, educational connections. We can share our experiences. Actually, we do this in Recep Tayyip Erdoğan Hospital. I want to give example. For example, we built up 44, I think, city hospitals in Turkey.
That's huge success in the healthcare reform.
Big hospitals, thousands of patients base, and under this there is a good and there is huge experiences. For example, in Ankara there is two big hospital, Bilkent City Hospital and Etlik City Hospital. Our surgery room nurse is coming from Bilkent hospital, and she carry all experiences to Mogadishu.
Huge.
This is very, very important.
That's 2,000, 3,000 bed hospitals, 4,000 bed hospitals. You're carrying all of them.
Yes.
There is also in Istanbul, Başakşehir, right?
Yes, they are carrying all
5,000 bed
and
hospital.
this is very important.
Yes.
Very, very important. Experiences is information.
For sure.
Experiences is health. This is very important thing, and they are sharing all what they know.
This is Turkey can do. As brothers, we're ready to share.
Yeah, we are ready.
If they come, we help them train. If we go, we're there to support.
Yes.
This is like almost 700, 800 people from Turkey in the hospital, but the other 300, 400 from Somalia. A good team that you have combined, 1100, 1200 health worker, right, in Mogadishu.
This is Turkish people character. I think we are very pleased to share our experiences, everything, our foods, waters, our lives, our experiences. This is cultural
Yes.
experiences. So I think I had a good time in this country. I learned many things about the field, about the people, and I had new experiences, the director experiences.
I heard they didn't want you to leave. I know you're not gonna tell, but I will tell.
I always say, I love Somali. I always say, and I love Africa,
Beautiful.
especially. I plan to visit some African countries.
Inshallah. We'll
Because
go together, inshallah.
inshallah,
Inshallah.
maybe one day.
You don't know. I also want to thank you and recognize you received a very important award for your services. Tell me about who gave this award to you and why did they give this award to you? Is it because of the services you have done to the Somalian nation, to the patients, to the doctors, to the nurses? It's a very, I was so excited. I was so proud as your Turkish brother that you have received this award.
Somali Health Minister Ali Hacı Adan said to me, Hocam, he invited to the evening dinner, and I had a dinner with the ministers, and he said that, Dr. Mevlüt Karataş, you did open heart surgery. You are trying to open chemotherapy unit, and you opened obstetric and gynecology and children hospital. If you do organ transplantation,
That's it.
I can sleep.
With a good morale, with
Yes,
in a nice way.
I can sleep with good moral, and yes, I think this sentence is very important for me. I understand that we did good things in health in Somalia, and
In a short period, in 8 months,
in the
relatively short
period that is 8 months, it's just 8 months, and Ali Hacı Adan and the President Hassan Sheikh Mahmud came to our hospital, and the Hassan Sheikh Mahmud said, Dr. Mevlüt, please stay this hospital for a while. I said that I had
Other obligations.
yes, and I promise you I will come back and I'll serve for Somali, and we took a picture in front of the table.
Mashallah.
So we love Somali people.
Billah.
We love Somali students. This is special students is our motivation,
Of course.
because one day we will be a director. They will be a director. They will be a minister. So this is my motivation actually. So we are always ready to share all our experiences
This is great.
in all field, in Somalia, in Tanzania, in Kenya, in Ghana, in Nigeria, in Mali. We are ready.
Thank you. My final words for you is, you are at the Global Health Program. You're now talking to more than 1 billion people. And at the Global Health Program and AfroTurk TV, what are your thoughts about this TV channel and the Global Health Program?
Yes.
And our plan to open a healthcare TV channel. Do you think we should start
Yes.
AfroTurk TV Health?
First, I celebrate you because you are opening a new channel, and you are working as a AfroTurk TV here. You are sharing with the TRT world your programs, and I really very happy to be here because you are doing very important issue here. You are connecting with us with African people, and as you know, it is very difficult to connection in this century. But you made a way to Africa by television, and you
It was not easy. 7 years. 7 years.
yes.
Dr. Hassan, Tuncay, Recep, Necati, Betül. We have many program producers, all of them We have Macy here, we have many people, more than a 50 group of producers. It's a teamwork.
Yes,
And,
yes.
and it's not easy. 7 years
I
in
know.
the making. But Allah helped us. Similarly, your story,
Yes.
when you have good intentions, Allah opens new doors for you. So.
Finally, I want to thank you, Yavuz Selim Slay, Dr. Yavuz Selim Slay. You invited to this program.
Of course.
This is the third section, I think. And
Yes.
I want to thank the Afro Turk TV
Thank you.
coordinators, managers. Thank you very much.
Thank you. We will not leave you alone. I'm officially proposing you to be a program producer at Afro Turk TV. We can do it, new programs together. You are a really great smile, great vision, and great heart, which is the most important thing. Thank you very much. On behalf of our team, Mevlüt, thank you. I can't thank you enough as my brother for being with us.
Thank you very much, brother, Dr. Slay.
Thank you. Ladies and gentlemen, this is the end of our episode, The Global Health, which has become one of the top programs across Africa. And today, we have a new star in healthcare, Professor Dr. Mevlüt Karataş. I made him an official offer to actually work with us in this TV channel. You will have negotiations with him, and we'll see what will happen. This is Dr. Yavuz Selim Slay, wishing you a wonderful rest of the week. Long live Africa, long live Turkey. Together, we're going to support and generate huge solutions for all the problems for Africa, because we believe African solutions for African problems. Take care and all the best. Bye.